Ruth Petran Consulting, Rich Stoop, Agricultural Workforce Specialist at Cornell University, and Al Trimchick, Extension Associate of Cornell University. We're also joined by our New York State Department of Agriculture and Markets colleagues, Steve Shermer, who is the Produce Safety Field Administrator, John Luker, who's the Assistant Director of the New York State Department of Agriculture and Markets Divisions of Food Safety and Inspection, and Dan McCarthy, who is the Acting Director of the New York State Department of Ag and Markets Division of Food Safety and Inspection. We are also joined by my colleagues in the Produce Safety Alliance team. Dr. Laura Cunha Maldonado is not here. Her name is on the slide, but she had to skip. Davis Blasini, who is our Spanish Language Extension Associate. Donna Clements, who is our Southwest Extension Associate. Connie Fisk, who is our Northwest Extension Associate. Ricardo Oriana, who is also a Spanish Language Extension Associate. And Tommy Saunders, who is our Southeast Extension Associate. So I thank all of them for taking their time today to be with us. What we're talking about is preparing for the upcoming season. What we're going to do today is we're going to talk about how the COVID pandemic will likely be influencing your business as you move forward. We're going to start with an update of IFS at CU resources that Al's going to run us through. Then we're going to share some COVID information from Callie. Rich is going to talk to us about business considerations. We're going to have some sanitation reminders relevant to both COVID prevention and food safety from Ruth. And then we're going to take questions as a group like we do for the typical office hours. I'm going to stop share so that Al can take us to the IFS.
You are muted, Al. Okay. Thank you very much for this. Yeah, the first thing I have to promote is our coronavirus boosters. So these used to be weekly short videos, 5 to 10 minutes, where we go over the latest COVID-19 numbers, and then we quickly discuss any of the hot topics that emerged that week. For example, last week we had Anika talk about how to prepare your workplace for vaccination. And then the same videos are also translated into Spanish by our colleague, Karen Ospina. So the recent ones are on our landing page, but you can find all the previous ones under podcasts and webinars. This landing page was a bit decluttered at one point. So we put all the food industry guidance under a separate tab. Under resources by commodity, everything is still there, including the produce related resources that you can check out. Under industry frequently asked questions, we added a bunch of new FAQs on vaccinations and new variants. We are doing our best to update all the old FAQs as well. We started, the newest thing is we started a new section on training that's supported by our USDA NIFA grant that's directed towards management level in food processing environment. So there are 3 modules that are already uploaded there. So make sure to check that out as well. We have of course, a big section on vaccines, as well as a section on new variants on our webpage. The one I always like to emphasize is tracking COVID-19. So there's a section with all different trackers on global, national, state level, as well as some of the big cities. Under infographics and posters, I would emphasize this one. So we updated this infographic on how to prioritize COVID-19 control strategies. Of course, now number 1 is get vaccinated as soon as possible. Don't think about what vaccine, the first one that's available, you should take it. But again, don't forget all the other control strategies: social distancing, wearing face coverings, washing your hands, not touching your face, cleaning and sanitizing the frequently touched surfaces. And the last one, but very important, minimize community spread. To finish, if you have any questions or comments, make sure you use our contact list on the webpage, and you can check our next office hours on our office hours tab. And with that, I think I covered all of it. Thank you very much.
Thanks, Al. I do want to pause here just to say, to reiterate what Al just said about that graphic that he showed. Vaccinations are getting more available, and that's good. And I know a lot of us on this call were talking before, we're in the middle of our vaccination series, or we're getting started. Some of us have Johnson & Johnson, some of us have Pfizer, some of us have Moderna. We're all following Al's advice, which is getting the one that's first available to us. So I want to make it clear that all of us from the IFS side and even our colleagues, we're following that recommendation, right? We're getting the one that's available. And it's interesting to see the variation across the country. The PSA team is located all across the country. Tommy's in Virginia, Donna's in California, Connie's in Nebraska, Davis is in Arizona. And it's interesting to see vaccination availability across the country. So even Ruth right now is waiting for hers. And so it's great. I think you should follow that. I think the other thing that Al said that's really pertinent to this discussion, which is why we're here today, is that it isn't over, right? You still have to wear a mask. You still have to social distance, even once you're through the vaccine series. We have different ones at home. I have a teenager at home who's not yet 16, so he's not eligible for the vaccination quite yet. So we have to protect him and be cognizant of him going to school, which they're trying to go back. So I just want to bring that up as a reminder for why we're here today and why we're talking about that. There you go, Callie. Can you see the screen?
Yes, thank you. All right, well, hello, everyone. Thanks for the opportunity just to share a few slides with you. I thought I'd take a minute to remind everyone about some of the differences between SARS-CoV-2 and viruses that you are very familiar with when it comes to thinking about food safety. And again, this is something that the food industry has done very well over the past almost 14 months. It's been a long time, right? But as we go forward into production and harvest seasons around the country, let's continue to remember we're balancing what we're doing to protect ourselves and our workers and our customers from SARS-CoV-2 infection, also thinking about norovirus and hepatitis A virus, other viruses that might be out there. So in thinking about norovirus and hepatitis A virus in particular, those two are structurally different from SARS-CoV-2. That's why until now, we have not been thinking about hand sanitizers to protect us from viruses. When we think about SARS-CoV-2, that has an envelope around the outside, and that's why we can use those hand sanitizers effectively against it, not so much against norovirus. So we really want to continue to think about washing our hands and think about surface transmission when it comes to norovirus, right? Again, just to reiterate, we do not seem to have any reasonable evidence that SARS-CoV-2 virus can be transmitted by food or food packaging, which is very different from norovirus. Next slide, please. So on this slide, this is an image, an infographic, if you will, that was designed by a member of my laboratory, and we've been using this quite a bit because I think it really explains well in these images what that envelope does for SARS-CoV-2. And you're probably hearing all about the changes in the spike protein, how it binds to different receptors. And so if you look on this image right away at the top, you see differences between these enveloped and non-enveloped viruses. That blue circle, that's this envelope that's made up of a lipid. That actually helps the virus, and you can see on the lower left, that helps the virus use what's called a fusion protein and bind to a specific receptor. And you've been hearing that there are these receptors called ACE2 that are in our nasal passages, in our respiratory tract. There's also some in our intestinal tracts. And that's why we can monitor SARS-CoV-2 in wastewater, because we shed it in feces and urine, because there are those receptors that are there. That virus is not infectious, though, and that's not how we see it being transmitted. It's really transmitted through this respiratory droplets, right? And that's why our masks are so important, as well as that physical distancing. But what's unique about that envelope, and when it's using that fusion protein, that can get damaged really easily. It's not very strong, it's not robust, and so this can fall apart pretty quickly. That's why it does not survive on surfaces, and this is SARS-CoV-2. It will not survive on surfaces. We don't see surface transmission because that envelope is very fragile in a way, right? It's important for binding to host cells, but it falls apart. But on the other hand, the non-enveloped norovirus is very robust, and that's why it can be transmitted by surfaces. That's why we think so much about cleaning and sanitation and hand washing when it comes to norovirus transmission. Next slide, please. And here you'll be able to see just how efficient and effective that hand washing really has been. Right, so this top left infographic, that's something you are familiar with seeing, right? We know norovirus can be transmitted in those different ways, and we're very careful about that when it comes to the food industry. But if you look at this graph, that gray shading, that's the range of norovirus outbreaks that happened between 2012 and 2019. That dotted or dashed line that falls dramatically when we started into lockdown in the United States. In 2020, you can see in March, late March, middle March, April, that's norovirus cases that started to fall when we were not socializing, not eating at restaurants, washing our hands better, all of those different things. And then if you look at the red, that's where we are from 2020 to 2021. And again, really low cases of norovirus, right? And so this tells us in a very dramatic fashion, I think, that, well, not eating at restaurants could be one thing, right? Because we do know that restaurant transmission is important when it comes to norovirus, but I'm going to try to focus more on our hand washing and our behavior, because that's something we can really control. And if we want to say how important that is, look at the direct impact that it's had on norovirus. So I want to reiterate how important it is that we continue to wash our hands, we continue to have those either small units or things that are accessible to our consumers if we're thinking about produce markets and things like that. I know I'm excited to start going to those again now that the sun is coming out here in the Northeast. And then on the left-hand side, you can see that very common picture of those spike proteins on SARS-CoV-2, right? That's really different from norovirus. Look at those puzzle pieces on the norovirus capsid. They fit together perfectly. That's why it's hard to disrupt, right? It's easily transmitted by surfaces. We don't use hand sanitizer, but when you look at those spike proteins, they're kind of delicate, right? They're important for binding and host infection, but they're not involved in surface transmission. So keep cleaning and sanitizing, keep washing our hands as we think about all of food safety, right? As well as what we've been doing to reduce transmission of SARS-CoV-2. But I think this really shows us how important all those activities are to keep us safe from norovirus as well. Thanks, Betsy.
Thanks, Callie. Really appreciate that update, and also combining the idea of food safety and prevention of COVID infections. Next, we're going to move to Rich, who's going to talk a little bit about reminders for opening your business.
All right, thanks, Betsy. And like we've talked about before, and like the messages we're hearing from the federal and state government level at this point, it's, let's not drop the ball here. We're so close to the end, hopefully, and we're getting into a place where we'll have vaccinations for everyone in the country. But in our businesses and in our personal lives, we need to make sure we're keeping up those good practices. And so it's very easy for all of our employees to, just like everyone else, to want to relax and get away from these social distancing requirements. But it's important for leaders and businesses to demonstrate those good behaviors and to keep everyone focused on them and keep doing those as well. Next slide, Betsy. So a couple of reminders, mainly from a New York perspective. New York introduced paid leave at the beginning of the outbreak, and unlike the federal paid leave, which ended at the end of 2020, the New York COVID paid leave remains in place. And in fact, it is in place as long as we have infections taking place from COVID-19. So our New York employers out there, while sick leave also became, sick and safe leave became in a different legislation, became part of what employers had to provide in 2020. The COVID leave remains separate and still available to employees. So there's been quite a bit of confusion about that. But anyway, it remains in place as long as quarantine or isolation is a possibility. And the amount depends on the employer size, and I won't go into the details on that, but it could be 5 unpaid days for small employers, 5 paid days for employers up to 99 employees, and then over 99 employees, it is 14 paid days. And another change that happened, it was a little bit unclear as to whether an employee could use that more than once, that paid leave. And the reality is, yes, they can, according to New York State Department of Labor, they can use it for up to 3 incidences. So that is 3 of those time periods. If 5 paid days is required, they could, in effect, get up to 15 days of paid leave, or 14 times 3 if you're a larger employer. So up to 3 incidences. The latter 2 do require a positive test for them to be able to use that. So that has to be documented. The first one does not. As of March 12th, this is another new thing. New York employers must provide paid leave for vaccinations. And that's up to 4 hours at one time. And it could be 2 separate events, corresponding with some of the shots that require 2 inoculations. So there's been some questions about that as well. And employers have asked, so if an employee goes and gets their vaccination outside of work time, outside of scheduled work time, do I have to pay them for those hours? And the answer to that is no. This is only in a situation where someone is leaving their scheduled work time and going to get a vaccination. All employers are required to provide those 4 hours of paid leave for each incident. It doesn't have to be 4 hours. If the employee gets back in less than 4 hours, it's like any other type of paid leave. You just cover that amount of time that is needed for that. So keep that in mind, and all costs are borne by the employer for that. Next slide. Another thing to keep in mind in New York, we have the New York Forward Business Safety Plans. And as farms are gearing up and bringing employees in for the upcoming crop season, make sure you have those business safety plans in place. It really can be the same one you had last year. Just tweak that and adapt it for whatever changes you have going into this crop year, but they're still required. Nothing has changed there. They're still required. This shows the website that you can go to in New York to get the instructions and to get the template. Still don't be confused. The template that we used for farms is still the non-food agriculture template. It's the only one that's available out there. So don't be confused about that. If you are a food producing business, you can use that same template. And next slide, Betsy. And we also created some resources that were more helpful and applied for those businesses that were putting those business safety plans in place. You can find those resources at the Ag Workforce website. And we broke it down by dairy businesses and fruit and vegetable businesses and equine boarding businesses and retail businesses. We broke it down by a whole lot of different approaches and put recommendations and some guidance language into the template to help you better build your plan. So the blank templates in various formats that might help you, considerations, and then key references and links to other support documents, many of which are on the websites that you've already seen to help you write your plans. But get those in place. I will tell you that whenever there have been some outbreaks in businesses, the very first thing that the local health department asks the business is, where's your safety plan? And you need to have that safety plan in place because they're going to ask for it. In terms of liability, protecting your business down the road, you need to have a plan in place, partly because of the state requirement, partly because, if you get into a difficult situation, some lawsuits down the road, and it turns out that you don't have any plans and that you weren't following the state's recommendations, you're going to have a pretty tough time defending yourself in that kind of a situation. Not to mention, it's the right thing to do. Have a plan train your employees on it and make sure that it's taking place the way it needs to. Thanks, Betsy.
Thanks, Rich. There is a question that came in the chat box. Does the employee need to ask for the time for vaccine? So I guess they're asking, do they need to request the time off, or if they get a slot, can they just, find out that day they have a slot? I think that's what the question is about.
Yeah, good question. And like a lot of laws like this, the state doesn't really lay out specific parameters around that. My recommendation would be to put the same requirements into your policy that you have for other leave. Ask, especially sick leave, ask employees to let you know as quickly as possible, because obviously if it's a shift that they're supposed to cover, then the business needs to do something to cover that. But people might have to schedule something fairly quickly or fairly short order if availability comes up. And so just like sick leave, which you can't always anticipate when you're going to feel sick, right? You might have to scramble pretty quickly. But yeah, ask your employees to report that as quickly as possible for the business purposes and for the coworkers' purposes as well.
Super. Thank you. And Beth went ahead and put your forward business safety plan in the chat box. So for those of you that are looking at the slide, that's now available in the chat box.
Great.
Thanks a bunch, Rich.
Yep.
Next, we're going to move to Ruth Petran.
Great. And you can hear me okay?
Yep, hear you great.
Perfect. All right. And as Betsy mentioned, I'm sorry for my funny background. I literally am sitting in my car outside of a store getting ready to go get my vaccine when we're done here. So flexibility is the way it is. I just wanted to touch briefly on some information about sanitation in this COVID era. And actually, Kelly gave a great lead into a lot of this information. So next slide, please. The reality is we have lots and lots of challenges and risks that we need to manage. So the key is to translate what do we know, so then we can apply the right kind of measures. I mean, this is just standard HACCP, it's standard risk management, and that's certainly what we've been doing for COVID. But through it all, we've certainly realized that cleaning and sanitation has been really important, and we know that lapses have led to problems. But from a COVID perspective, things have gotten interesting. Next slide, please. But just to ground us first, we have many different products that we need to think about using. All of us should know this, but a cleaner is something that removes soil. And it's really important that cleaning is done first so that the disinfectant or sanitizer that comes next can get to any microorganisms that might be there. Sanitizers are typically what we use in the food industry that reduces bacterial populations to a significant number, but may not eliminate all bacteria, but generally it is believed that use of a sanitizer reduces risks appropriately. Disinfecting is what we do for harder to kill kinds of organisms like some viruses. It's what's done in healthcare settings. So it kind of gives more oomph than a sanitizer. And keep in mind that from a regulatory perspective, food facilities are required to use an EPA registered sanitizer in your cleaning and sanitizing processes. So everybody should be doing this already. Next slide, please. So again, cleaning is first to remove any dirt or debris that might be on the surface using brushes, water, whatever's needed. Next slide. Then it's application of the right kind of detergent with some elbow grease or scrubbing to get off that dirt. Next slide, please. Rinsing is really important to help basically wash away those detergent residues, also any soil that's been removed and freed from that surface. And this is all around the next slide or next step. Next slide, please, Betsy. Thank you. Which is to make sure that that sanitizer that's approved can get to those organisms. What's really important here is obviously using that sanitizer appropriately. The label, as specified by the EPA, dictates how long it's supposed to be applied to the surface and other conditions. And you're looking for kill of microorganisms at this point. So it's important that those directions are followed, but in this order as well. So the procedures and the upfront kinds of things we just talked about are really important. Now, recently, CDC's recommendation has been to clean high-touch surfaces as needed. And just yesterday, they in fact updated some of their procedures to suggest that cleaning of high-touch surfaces could be done perhaps just once a day to manage risks, and with use of a disinfectant as necessary. And the next slide talks about that a little bit. Because there are times when we need to use a disinfectant. And Kelly gave a great distinction early on of the differences between norovirus and the virus that causes COVID-19 from an enveloped or structure standpoint. And that, in essence, dictates where a disinfectant might need to be used if we are worried about things like norovirus, because it takes more firepower, essentially, to kill a norovirus cell. Yesterday, in the CDC's recommendations, they stated that they recommended only using a disinfectant against SARS-CoV-2 when there has been a direct suspect or confirmed case within that facility and potentially contaminating that surface within the past 24 hours. Next slide, please. So if there is a need to disinfect a surface under one of these kinds of conditions, again, following the CDC most recent guidance, pre-cleaning is very important to, again, get rid of any debris, using that disinfectant product, again, to give this higher level of kill, allowing time for that disinfectant to work, drying the surface off, and then following that with a rinse step and use of a sanitizer. So it's a little more complex than just the standard, wash, rinse, and sanitize kind of process. But again, using these products carefully is really important. Next slide, please. And then just to highlight what Al showed early on, these prioritization of risk strategies is really important to aim these at the transmission routes. And certainly cleaning and sanitizing, disinfecting, et cetera, is important to manage all kinds of risks, but we do see that it's lower on this list than some of the other measures that we're familiar with. Next slide, please. But I do want to remind you that sanitation concerns are a concern in the food industry. In fact, FDA published just earlier this year their observations they've seen on inspections in fiscal year 2020. And we can see that a large chunk of them do end up being sanitation related. Now, there's other reasons for violations related to HACCP and FSMA kinds of things. But regardless, sanitation still does cause violations. And next slide, please. And we know that certain microorganisms can lead to, or their presence can lead to illnesses, as we know, and have been linked to lapses in sanitation. Norovirus, we know, Salmonella, Listeria, and even spoilage from things like yeast and molds have all been linked, and there likely are others as well to lapses in sanitation. And the last slide, please. So just, key messages is to think about what the risks exist, understand that sanitizers and disinfectants can help manage these, but making sure they're used properly, using the right product, following the directions, and really considering it in the whole scheme of risk management is really important. And I will stop there. Thank you.
Thank you so much, Ruth. I think that discussion of when we need to disinfect versus when we need to sanitize is very important. We were doing a sanitation workshop last week with some growers, and one of the growers was sharing some of their protocols and the issue of when you've had, say, bird poop contamination of a surface versus when you're just doing your normal cleaning and sanitizing, right? When do we need to disinfect versus when do we need to just clean and sanitize? And I think that's very relevant to this COVID risk as well, as you just pointed out. So thank you very much for doing that from the car, Ruth. So trying to pull some of these things together, one of the things is don't forget about food safety. I thought that chart that Ruth just showed about sanitation issues being an issue in inspections is certainly right up front. Use the overlap of COVID prevention and food safety to your advantage where you can, right? Callie showed hand washing really reducing norovirus, right? As a result of hand washing for COVID, very important. Benefit from the lessons learned last year. I know Rich had a couple of grower panels and some of the other workshops that I saw this year where they brought in growers to talk about what did you change based on COVID? Are you going to keep that change? And a lot of growers were saying, yeah, I'm actually going to keep the changes I made for COVID because it was better for business. It was better for food safety. So we're seeing a lot of, I want to say, silver linings to a really gloomy COVID cloud. And I think we need to think about that as we get ready for the season. Update your farm food safety plan if you've changed things, if you've changed chemicals, if you've changed some of those SOPs, make sure they're updated. Update your employee training. Make sure they know what the expectations are and if anything has changed. Increasing communication with both customers and employees, I think, has been one of the big things we've learned during COVID. Making expectations clear to everyone. Last year, for the growers that did this communication well, it went very, very well for their farms. Some growers said out loud they had the best growing season they've ever had. And I think part of it is they upped their game with communication and it paid off. Understand those market expectations as best you can. Again, I know some growers lost a lot of markets when they were supplying to restaurants and the restaurants closed, those markets went away. But they might be coming back and you need to keep up with those food safety expectations, audits, whatever food safety plan review, whatever those markets are requiring, you need to keep up with that. So that's how I kind of wanted to wrap this all together with what Callie, Rich, and Ruth shared with us, and to open it up now to questions that you all may have.